Bismillahirrahmanirrahim. I welcome you all in this video. In this video, we are going to discuss a very interesting question which says whether the vaccination or treatment is sufficiently effective for what you can say controlling COVID-19 outbreak. So, the question is quite relevant in terms of the recent outbreak of coronavirus, and we are trying to study whether the current vaccine or treatment is itself a sufficient factor responsible or it's something else. So in the light of epidemiological data and from a scientific perspective, what we are presenting right now is about the whooping cough, and we are going to discuss this in a perspective which is slightly logical in this frame. So if we look at the death rates per million in 1860s, the death rate was substantially high. So over here what you are looking on the x-axis are the number of years, and in 1860s, 90s and 1880s the number of people dying from whooping cough, which is basically caused by Bordetella pertussis, was substantially high. But with the passage of time, we are seeing a certain decline in the deaths of people coming in the after subsequent years from 1860s till 1900, and then sufficiently till 1930s as well. So this is the area of 1930. So the decline of the incidence of whooping cough death rate is basically there is nothing ongoing in terms of regular treatment being devised. The treatment was devised in 1940s, where a vaccine approach is being initiated. So this is a vaccine which is being designed, and then the treatment of antibiotics like penicillin, streptomycin, and such kind of drugs were identified in 1940s era. So it is basically that decline was basically attributed to the human common sense to avoid the diseased individual, to improve its social well-being. So this is how individuals controlled whooping cough. Obviously their vaccine and the treatment regime also have an effect, and it further reduced the death rate of individuals. But during the course of a century, almost a century, the main 70% area from let's say 1860, so this is 1860 years, and over here we are talking about something happening in 1940s, right? So something happening in 1940s, the substantial proportion of the this era was being dealt with what you can say social understanding of the probable risk factors and how we can reduce them. A similar interesting example was observed in diphtheria. Over here we can see that in 1860s the death rate of the people dying from this disease was substantially high, around 400 people per million were dying from this diphtheria incidence. And similarly the tests for diagnosis as well as the penicillin drug of choice was observed in 1940s. So the treatment and vaccination strategy is, although it's very important, but the thing is that all those like scarlet fever and respiratory tuberculosis incidents, which also started, the incidence was substantially high in the previous centuries, but it is gradually reducing and it is almost gone over here based on chemotherapy and recent vaccination and treatment regimes. So in this perspective, the core thing which we should learn is that it's not only the vaccine or the treatment which is responsible to cure or to save us from any outbreak. It is basically an approach towards the social well-being. So the factors which are still addressed largely by the government towards the social norms. So all infectious diseases, in fact there is an interesting paper which is also saying that the infectious rate could also be controlled. Infections Infectious versus social norms are the core things which decide the ultimate fate of a disease outbreak. So, whenever an individual is sick, people start acting in identifying the culprit and started themselves distancing away. So suppose this red individual is sick, so the people start an understanding not to communicate with them so often, so they maintain a safe distance from that individual. The story of vaccines, the story of vaccines and treatment, they are also important, but their initiation or their discoveries were made quite after 60, 70 years. And during that time of 70 years, from 1860s to 900, the area was substantially been addressed by our forefathers based on the social norms, which is an important paradigm, and we should take this factor in account while talking about corona vaccination and treatment. Though they are important, but apart from their importance, what we need to learn is that the usage of the current advisories given by our respective governments as well as World Health Organizations are of prime importance.